Well, thank you very much, Chairman Alexander. As I said yesterday, after so much partisanship around the future of health care in our country, I am really glad that these hearings give us an opportunity to take a different approach and hopefully find some common ground. I appreciate your leadership in starting this conversation, and I am really grateful to all of our colleagues who are joining in on this. And of course, I want to thank all the governors who are here today. I noticed that their names either start with B or H. Was that the requirement, or did that just happen? But it's great to have all of you here today as well. As you know, governors have added a really valuable perspective to the healthcare discussion so far, so I'm really glad that our committee will have the chance to get your input as we enter this next phase of working to really stabilize the markets and lower costs for our constituents in the near term. The truth is that there's actually a lot many Democrats and Republicans agree on when it comes to this specific goal. As a starting point, even if we don't all agree on the cause, we do agree on the problem itself. Families are facing higher premiums and fewer options as a result of uncertainty in our healthcare system. And Democrats have a number of ideas which I'll be interested in discussing with all of you today to address this problem. I want to just give a few examples. Senator Shaheen introduced a multi-year fix to ensure out-of-pocket cost reductions under the Affordable Care Act are not cut off. We'll need a long-term stability for this program if we want insurers to stop worrying about uncertainty long enough to actually lower premiums for patients. Senator Kaine and Carper put forward legislation to help with coverage costs for our sickest patients. Senators McCaskill and Schatz have proposals on how we prevent bare counties moving forward. And many of us are also interested in ensuring open enrollment is as effective as possible this year, given the President's decision to slash efforts to help people get coverage. And it's not just Democrats in the Senate who are looking at a wide range of ideas to strengthen markets and lower families' health care costs in the near future. Governors Kasich and Hickenlooper, who's here with us, have put forward a plan including many policies that parallel those I've mentioned, and their plan should help inform our conversation here in Congress. I was especially pleased the governor's plan would maintain protections in current law for patients like those with pre-existing conditions and women seeking maternity care. Because as I said yesterday, this needs to be a conversation about moving our healthcare system forward, not backward. It is certainly not an opportunity to roll back protections for patients or a chance to hand power back to the insurance companies. So I hope we can focus on areas of common ground rather than getting bogged down in ideology again that drove that Trump care debate. And if we can do this, I believe a bipartisan agreement on health care reform is possible. Not easy, but possible. And I'm very hopeful we'll not only succeed, but be able to build on the near-term steps to tackle the larger challenges families continue to face in getting the affordable care they need. So again, I want to thank Chairman Alexander for moving us forward on this. I want to thank all of our colleagues who are here and all the governors who are here to help us with this discussion, and I really look forward to it. So thank you.